Hi everyone, myself is Shazeen Aslam. Today I am pleased to present my presentation titled Explainable Machine Learning for Type 2 Diabetes Prediction at IMCOM 2026. Our main content for the today presentation is introduction and motivation, methodology and dataset, results and performance, explainable AI, conclusion and future outcomes. Next, we move to introduction. Type 2 diabetes is a major and growing problem worldwide, especially in UK. Nearly 6 million people are affected with diagnosed diabetes, and nearly 1.3 million people are still undiagnosed. Early diagnosis is key to prevent serious health issues, and the lifestyle factors like obesity and inactivity are driving to increase this into the diabetes. Next, we move to motivation of research. This research focuses on using machine learning, especially tree-based models, to predict diabetes using simple self-reported data. The goal is to make a model suitable for NHS integration. However, two key issues, interpretability and class imbalance, must be addressed. Doctor and patient need to understand and trust the model prediction. Next, I move to novelty approach. We create an explainable machine learning pipeline for type 2 diabetes detection designed to perform well under class imbalance and prioritize sensitivity, maintain transparency through sharp and live for model explainability, with support trust and compliance within the NHS system. Now I move to literature review. Machine learning machine learning approaches have shown dominant performance on diabetes datasets like PIMA and BFS. Test accuracy reported in multi-model studies using BFS typically range from 74% to 82%. Numerous analyses on BRFS 2014-15 report top model accuracy between 80% to 86%. A boosting method like XGBoost, CatBoost, and LightGBM typically outperform single model baseline on BFS type 2 prediction. Next, I move to methodology overview. Our research followed a clear workflow from data loading to model explainability. We use standard scaling, resampling method like SMORT, SMORT-EN, and several classified. Each model was trained before and after resampling to evaluate improvements. Performance was measured using balanced accuracy, precision, recall, and F1 score. These metrics ensured fair performance across both diabetic and no diabetic group. Now we move to dataset description. I use BFS 2015 dataset, which comprises over 250,000 samples and 22 features, including the target features. A critical characteristic is the high class imbalance. About 86% of samples belong to no diabetes class, and only 14% belong to diabetes class. Next, I move to tackling the class imbalance. To tackle the class imbalance, we use the resampling method like the SMORT and SMORT-EM. SMORT generate a new synthetic diabetes sample and SMORT-EN to use further clean the data set according to the diabetes class. Next, there's the result performance and resampling. Before resampling applies, all models showed a decent overall performance with accuracies around 86%, with the light GBM achieved the highest accuracy before resampling, about 86%. All models performed exceptionally well on the majority class, no diabetes. Next, I will show the visualization of performance after resampling. After resampling apply, overall accuracy reached to 93%. There are three bars. One is the initial in the blue before resampling, and orange one is the smooth method after resampling, and the smooth EN method in the green one. You can see the smooth EN achieve the higher accuracy, about 93% and 92% in most cases. Next, I move to comparison of precision, recall, and one score. Here you can see the Smarty and achieve the higher accuracy, about 93% as compared to the Smart or the before resampling. Next, I move to the role of explainable AI. We apply Lime and feature importance to interpret model decisions. Explainability is key for clinical acceptance and meeting NHS standards. For tree-based ensemble model, Lime explainer efficiently computes shapely values. Lime provides local explanations, enabling clinicians to quickly inspect individual predictions. These techniques bridge the gap between AI predictions and clinical reasoning. Next, I move to the visualization of explainable AI. At right side, you can see we use the feature importance and the line for the explainable AI. High blood pressure, high cholesterol, general health, and gender are the highest indicator for the diabetes. You can see the prediction probabilities, no diabetes about 84% and diabetes about 16%. On left side, you can see the BMI, high blood pressure, age, and the BMI general health. These are the highest risk factor in diabetes. You can see visualization. We use the Lime and the feature importance and the model performance as well to predict it. Next, I will move to personalized intervention. Feature importance analysis identifies BMI and age as the strongest predictors. High blood pressure, physical activity, income, and general health also specific. Line provided individual level insights into how specific feature influence diabetes risk. Factors such as high blood pressure or poor general health were shown to raise the likelihood of diabetes. Finding highlight the importance of weight management, diet control, and regular health screening. These insights support personalized prevention strategies and targeted intervention for high-risk groups. Next, I will move to conclusion and the future direction. Machine learning model personalized diabetes with 93% accuracy using careful cross-validation on the BFS 2015 dataset. We use explainability through feature importance and line build clinician trust and support NHS in adoption. Here we use the explainability. We provide transparent decision that the clinicians and patient can understand and can accept our result because our results are the transparent. Here, patient and clinician can easily understand and accept our result. Next step include clinical validation using EHR or biomarker data. I want to expand further with the integration of NHS, use the real-world data, EHR biomarker data. Next, this research show a pathway toward trustworthy and interpretable AI in healthcare. Basically, we use the machine learning models to predict the diabetes risk. This is the modern technique. We achieve the overall accuracy about 93%. We use explainable for the transparent decision making. The patient and the clinician can understand it. Next, I will move forward with the NHS integration or the other organization for that. Thank you so much.